Imagine your body sending you whispers of danger, subtle clues you might dismiss as no big deal until it's too late. Today, I'm uncovering the hidden signs of colon cancer, a silent killer that's skyrocketing among young people, claiming lives before they even suspect it. Did you know cases in those under 55 have doubled, making it the top cancer killer for ages 20 to 49? Ignoring these signs could cost you everything, but catching them early could save your life. Stick with me to learn these critical red flags, and at the end, I'll reveal a surprising prevention tip that could slash your risk, something you'll wish you knew sooner. One of the earliest signs of colon cancer to watch for is a change in your bowel habits. This might sound vague, but it's critical to pay attention to. Maybe you've always had regular bowel movements, but suddenly you're dealing with constipation that just won't quit. Or perhaps you're experiencing frequent loose stools or diarrhea that seems out of the ordinary. These changes can be one of the first indicators of colon cancer. Now, let's be clear, having diarrhea or constipation for a week or two isn't uncommon and usually isn't cause for panic. It could be something as simple as a dietary change, stress, or a minor stomach bug. But if these changes persist for more than a few weeks, it's time to take notice. Why does this happen? The colon's job is to absorb water and form stool. A tumor or mass in the colon can disrupt this process, leading to chronic diarrhea or constipation. For example, a growth might irritate the colon's lining, causing it to secrete more water and speed up the movement of digestive material, resulting in diarrhea. On the other hand, a tumor can act like a roadblock, slowing down or even stopping stool passage, which leads to constipation. In some cases, you might notice an alternating pattern of diarrhea and constipation. This can happen when a tumor intermittently obstructs the colon, causing unpredictable bowel habits. If you're experiencing any of these patterns for an extended period, don't ignore it. It's a signal to get checked out. These changes might feel embarrassing to discuss, but they're your body's way of waving a red flag, and catching them early can make all the difference. Another subtle but serious sign of colon cancer is unexplained weight loss. This is one of those symptoms that can sneak up on you. You might notice your clothes fitting looser or the scale showing a lower number, even though you haven't changed your diet or exercise routine. Colon cancer can lead to weight loss in two key ways. First, a tumor in the colon can physically interfere with your body's ability to absorb nutrients properly. The colon plays a role in extracting nutrients from food, and a mass can disrupt that process, leaving your body starved of essential fuel. Second, colon cancer, like many other cancers, can divert your body's resources to support its own growth. Tumors release substances called cytokines, which essentially hijack your body's signaling pathways, redirecting nutrients to feed the cancer instead of nourishing you. This can lead to unintentional weight loss, even if you're eating normally. If you're losing weight without trying, say, 5% or more of your body weight over a few months, it's a red flag. While colon cancer isn't the only cause of unexplained weight loss, it's serious enough that you should get evaluated for it, along with other potential cancers or health issues. Weight loss might seem like a welcome change at first, but when it's unexplained, it's a sign your body is struggling, and you need to listen. Let's talk about one of the most recognizable signs of colon cancer: blood in your stool, known medically as hematochezia. This is a hallmark symptom, and it's one you should never ignore. The blood might appear bright red if it's coming from the lower colon or rectum, or it could look dark or black if the bleeding originates higher up in the digestive system, like the ascending colon on the right side of your abdomen. As the blood travels through your digestive tract, it interacts with digestive chemicals, which can turn it from red to a tarry black color, often described as melena. Now, here's an important point: blood in the stool doesn't always mean cancer. In fact, the most common cause is something less serious, like hemorrhoids, which are swollen veins in the rectum or anus that can bleed. Another common culprit is diverticulosis, a condition where small pouches form in the walls of your intestine and occasionally bleed or get infected. But here's the catch. You can't assume the blood is from something benign. If you notice blood in your stool, on the toilet paper after wiping, or in the toilet bowl, you need to see a doctor to rule out something more serious like colon cancer. Even a single instance of unexplained bleeding warrants a checkup. It's tempting to brush it off as just hemorrhoids, but that assumption could delay a critical diagnosis. This brings us to another related symptom, iron deficiency anemia. This happens when colon cancer causes chronic, low-grade bleeding that isn't always visible to the naked eye. Over time, this slow blood loss depletes your body's iron stores. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, your body can't make enough healthy red blood cells, leading to anemia. Symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, and even dizziness. While colon cancer isn't the most common cause of iron deficiency anemia, things like inadequate dietary iron, heavy menstrual periods, or kidney disease are more likely. It's a possibility that needs to be ruled out, especially in men or postmenopausal women who don't have obvious reasons for iron loss. If you're diagnosed with low iron or anemia, your doctor should consider colon cancer as a potential cause, particularly if other symptoms like changes in bowel habits or blood in the stool are present. Anemia can feel like you're just run down, but it's often a sign of something deeper, and colon cancer could be the culprit. Another sign to watch for is a feeling of incomplete evacuation after a bowel movement known medically as tenesmus. This is that frustrating sensation where you feel like you still need to go even after you've just been to the bathroom. It's especially common with tumors in the lower colon or rectum, where the growth can press on the bowel wall or mimic the feeling of stool remaining in the rectum. This sensation can be mistaken for something less serious like irritable bowel syndrome, but if it persists for weeks, it's a warning sign. You might find yourself straining or feeling like you're never fully done, which can be both uncomfortable and concerning. If this feeling lingers, don't brush it off as just a digestive quirk. Get it checked out. Tenesmus can disrupt your daily life, and it's your body's way of signaling that something might be wrong in the lower digestive tract. Excessive gas or bloating is another symptom that might point to colon cancer, especially if it's persistent. We all get bloated from time to time, often due to diet or temporary digestive issues. But if you're experiencing ongoing bloating or excessive gas without recent changes in your eating habits, it could be a sign of something more serious. Tumors in the colon can cause bloating in several ways. A large growth might physically block the colon, trapping gas and leading to abdominal discomfort. Alternatively, a tumor can disrupt the normal digestion and fermentation of food, throwing off the balance of bacteria in your gut. Your gut microbiome is crucial for healthy digestion, and when it's disrupted, it can lead to increased gas production. Sometimes, a partial blockage from a tumor slows down the passage of waste, giving bacteria more time to ferment undigested food, which produces even more gas. If bloating or gas persists for more than a few weeks and isn't tied to dietary changes, it's time to see a doctor. Bloating might seem like a minor inconvenience, but when it's chronic, it could be a clue to something more serious like colon cancer. Perhaps the most unsettling fact about colon cancer is that it often has no symptoms in its early stages. That's what makes it so dangerous and why screening is so critical. By the time you start noticing symptoms, the cancer may already be advanced, which drastically lowers your chances of survival. This is why being proactive about screening is non-negotiable. In the US, the recommendation for people at average risk is to start screening at age 45. The gold standard is a colonoscopy, a procedure where a doctor uses a long, flexible tube with a camera to examine your entire colon. If they find polyps or abnormal tissue, they can remove them right then and there and send them for a biopsy to check for cancer. Colonoscopies are highly effective, but they do require bowel preparation the day before, which involves drinking a special solution to clear out your colon. Not exactly pleasant. There's also a small risk of complications like bleeding or perforation, and since colonoscopies are typically done under sedation, there's a minor risk from the anesthesia as well. If a colonoscopy doesn't sound appealing, there are less invasive options you can discuss with your doctor. Stool-based tests, like the fecal occult blood test or fecal immunochemical test, check for hidden blood in your stool that could indicate colon cancer. Some advanced stool tests can even detect DNA changes associated with cancer or large polyps. These tests are convenient. You can do them at home without sedation or invasive procedures, but they're not as effective at catching early polyps compared to a colonoscopy. Plus, they need to be repeated regularly, anywhere from every year to every 3 years, depending on the test. The key is to choose a screening method that works for you and stick with it. Doing something is always better than doing nothing. Stool tests are a great option for those who want a less invasive approach, but they require consistency to be effective. For some people, screening needs to start earlier than age 45. If you have risk factors like inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, your doctor may recommend starting screenings in your 20s or 30s. A family history of colon cancer or high-risk polyps also changes the timeline. The general rule is to start screening at age 40 or 10 years before the age your relative was diagnosed, whichever comes first. For example, if your parent was diagnosed with colon cancer at 35, you'd need to start screening at 25. The specifics depend on your family history and other risk factors, so your doctor can guide you on the best plan. If you have a first-degree relative with colon cancer, your risk is significantly higher and earlier screening is crucial. Other risk factors, like a history of smoking, obesity, or a diet high in red or processed meats, can also increase your risk, so it's worth having an open conversation with your doctor about your personal health profile. Beyond recognizing these signs, prevention is just as important. Colon cancer rates are rising in younger people, and while we don't have all the answers yet, lifestyle factors play a significant role in lowering your risk. A diet rich in fiber, fruits, and vegetables, regular physical activity, maintaining a healthy weight, and avoiding smoking or excessive alcohol can all help reduce your risk. Limiting red and processed meats, which have been linked to colon cancer, is another smart move. Some studies suggest that regular use of nonsteroidal anti-inflammatory drugs like aspirin may lower risk, but this comes with other health considerations, so always consult your doctor before starting any medication for prevention. I'll be diving deeper into prevention strategies in a future video, so make sure to subscribe and stay tuned for that. Let's recap the key signs to watch for: changes in bowel habits like chronic diarrhea or constipation, unexplained weight loss, blood in your stool, iron deficiency, anemia, a feeling of incomplete evacuation, and persistent bloating or gas. These symptoms might seem minor or easy to dismiss, but if they last more than a few weeks, they're worth investigating. The absence of symptoms in early-stage colon cancer makes screening even more critical. Don't wait for your body to sound the alarm. By then, it might be too late. In the U.S., screening is recommended at age 45 for those at average risk, but earlier if you have risk factors. Whether you choose a colonoscopy or a stool-based test, the most important thing is to get screened regularly. Colonoscopies are the gold standard for a reason. They can prevent cancer by removing polyps before they turn cancerous. But stool tests are a solid alternative for those who prefer a less invasive option. The message is clear: don't wait for symptoms to act. Colon cancer is highly treatable when caught early, but it's a race against time. Listen to your body, get screened, and encourage your loved ones to do the same. Share this information with everyone you care about. It could save a life. Early detection is our best weapon against this disease, and awareness is the first step. Stay